Hi, good evening, and thank you so much for coming back to us week after week. Can you believe this is part 6 of Making Sense of the Crisis? This is the 6th week that we have come live from Facebook at 7 o'clock. We really are picking up viewers and people are becoming regular watchers, which is excellent. If you're watching this from anywhere other than the People's Assembly page, this is just a little reminder that this is a People's Assembly broadcast. And I just want to tell you a really quick kind of synopsis of what the People's Assembly is. So the People's Assembly is a grassroots campaigning organisation that was founded really with the political purpose of changing the narrative on austerity. And by austerity, we mean the huge swathing cuts to public services that the People's Assembly were arguing since day one, really, that were not a political necessity, but were a political choice to change the nature of the state, to change the nature of what government did, to privatise huge parts of society. And they won the argument alongside, lots of other public figures and campaign groups. They persisted in making that argument. The People's Assembly has local groups that campaign on very, very local issues. And it has a national operation too, where you might have seen huge demonstrations against the government over all sorts of things like the privatisation of the NHS, like any other kind of social issue. They have been at the forefront of campaigning for that. It is a non-sectarian organisation. And by that, I mean it welcomes all elements of the left, people who are attracted to different political parties on the left, different campaign groups on the left, anyone really that believes that there is a potential for a different world, a better world, that really we should publicly own things, they shouldn't be privatised. The People's Assembly is a place for you. So if you've not engaged ever before, all you have to do is like the People's Assembly Against Austerity Facebook page, make contact on that page. There probably is a local group to you. If there's not a local group, you could start one up. But I can guarantee you this, people will be so happy that you made contact, so happy for you to get in touch. Don't worry about feeling like you have to know too much or that you won't know enough. You will be welcomed by very friendly activists. Now, I'd really like it. I know I go on about this all the time, but we want people who aren't necessarily engaging in political content all of the time to hear what our speakers tonight have got to say. So please share this video, share as far and wide as you can, and tag somebody that you potentially argue with sometimes, tag them in this, tag a social care worker. Tonight is all about social care and the unfolding crisis in the social care sector. We have two amazing speakers tonight, Lydia Hayes and Professor Alison Pollock. And unfortunately, Lysandra can't be with us tonight, Lysandra Simpson, but we wish her well in all of the caring work that she is doing. Before I introduce our speakers, this week has been another incredibly difficult week. The Financial Times and the ONS are reporting, according to their modelling, over 41,000 people who have died. We also saw the incredibly harrowing, shocking, traumatizing Panorama programme, which talked about the chronic lack of protective equipment for frontline workers, particularly in the NHS and GP surgeries, the out-of-date stock, the inappropriate stock, the downgrading of coronavirus from the high consequences infectious disease list, an absolute scandal when, lots and lots of experts have called this the most serious public health crisis for over 100 years. That it should be removed from that list is quite staggering, to be honest. And then there was a kind of an outpouring from sections of the right in society to try and demean and diminish what was heard on that programme, saying there was some kind of left-wing takeover, that these were activists that had perhaps supported the Labour Party or been part of activist groups before, which is quite honestly shocking when the main contributors to that programme were NHS doctors and nurses and people representing workers, that isn't just taken seriously, and the content of that program taken seriously just shows that people are trying to run away from the truth of the matter and the serious failings of our politicians during this health and political crisis. I think that anybody that kind of saw or watches the government briefings, there seems to be a huge disconnect still between those very staged, very controlled, very confident daily government briefings and the story on the ground. So we know, because we saw that programme on Monday, that there is a chronic lack of protective equipment for people on the front line. And correct me if I'm wrong, because I didn't get to the end of the briefing because I was preparing for this, but I didn't hear any of the journalists ask about the crisis in PPE. I didn't hear anyone, and it was, a long way through the question, and I didn't hear anybody talking about the inadequate numbers of tests. And the last thing I'll say before I introduce our brilliant contributors tonight is, one thing I'm really concerned about is that we are kind of taking part in what really is not a lockdown. By calling it a lockdown, we're kind of taking part in the government's management, psychological management of this crisis, because we know that there are huge swathes of the workforce that are still being sent out to do non-essential jobs that have never been shielded from this virus in the way that some other workers had. And I feel like there's a change in mood, that people are starting to talk about preparedness to get back to work when the conditions that brought about the lockdown have not changed in any way or radically enough to justify an easing of the lockdown. And by that, I mean contact tracing, testing, having this disease under control, huge mass public health campaigns. But this is why we're here tonight. This is part of a series of trying to make sense of the crisis. And the two contributors tonight are undoubtedly experts in their field. I'm going to introduce Lydia Hayes first. I first was introduced to Lydia through her work with the Institute of Employment Rights. She advised me very extensively on why sectoral collective bargaining was so important to social care. And by that, I mean a system where pay terms and conditions are negotiated and rather than just implemented by the employer. She might say a bit more about that in her contribution. But Lydia published a multi-award-winning book in 2017 called Stories of Care, a Labour Law. She, as I said, is also part of the Institute of Employment Rights grouping of experts. And I am very, very pleased that you are going to contribute to this show tonight. So over to you, Lydia.
Thanks, Laura. I'm really pleased to be here. I'm currently working at the University of Kent with two colleagues, Alison and Hannah, on a project where we are doing research about the regulation of social care in England, Scotland and Wales, and we've been working with Unison and the GMB too. So today we've put in recommendations to the Women and Equalities Committee at the House of Commons about the government's response to coronavirus. And so I wanted to start off by explaining three of the demands that we're making on the basis of the research that we've done. And that research is about the legal regulation of the sector, but it's also based on views and opinions that were expressed in a survey that was done of care workers about health and safety concerns that they've got. And that was done by Unison in the Northwest. And our recommendations, which are urgent recommendations to be addressed in the next 3 weeks, are for the government to step in with a guarantee of wages at average pay levels for care workers who need to self-isolate, because it is really shocking how many care workers are not getting any sick pay if they need to self-isolate. So in the research we did, 8 in 10 of the respondents who expressed an opinion about it said that they didn't believe they would get any pay at all. And of course, that's meaning that they're not self-isolating. And that's a big public health risk. It's a risk to them, their families, and to the people that use care and support services. And then the second recommendation we've made is in response to the guidelines which are coming forward and have come forward from Public Health England and the Department of Health and Social Care, which suggests that there's a rather large knowledge gap about what actually goes on in social care services, what the role is of care workers, what they actually do. And so we're recommending that care workers are immediately appointed into problem-solving roles so that they can take part in decision-making at local and national level about things like distribution of PPE or how staff resources are being organised, because people are losing their lives because of mistakes that are being made because of these knowledge gaps. And the third thing that we've done is ask for a review of a decision that's been made right across the UK, which has suspended routine inspection of care establishments by the sector regulators, because by suspending the inspections, I mean, admittedly, you know, things are very difficult at the moment and inspections couldn't happen like business as normal. But by not having any inspection at all, it means that we're risking regulators turning away from what is happening in care homes at the moment with no formal records of what's going on. And at a time of crisis, now is not the time to stop looking at compliance with regulations, to stop recording and examining care standards. So they're the three things that we're looking at in terms of, you know, immediate issues. But I think it's really important that we look at the structures that are causing the problems in social care, because this is not about government ministers being bad people. It's about the system that we have got in place, which is bad. And mistakes are being made and people are dying unnecessarily. And I want to see fewer mistakes and greater transparency. But at its core, the problem that the government has got is because of privatisation and fragmentation of social care. And this has been a matter of political consensus across Westminster for 20 years. The private sector's role in delivering social care is entrenched, and that's the kind of first layer of the onion, really, in terms of why the government is finding it so hard to get a grip on the crisis in the care sector. They don't have any central levers of control, and that's because it's the way the system is designed to be. So one of the conclusions in the book that I published, Stories of Care, was that people in positions of state power in the UK, so by that I mean some of our senior judges, politicians, policy experts, government ministers, they don't really believe deep down that care is the business of the state. They think it's actually a private matter. And we've had this political consensus, which has been about it's okay and justifiable to punish citizens who aren't economically productive. And probably, you know, one of the classic examples of that is the benefits sanction regime in terms of job seekers allowance. But it also applies to severe cuts for services for older and disabled people. And I don't know if you remember this, Laura, but back in 2018, the United Nations General Assembly Rapporteur Philip Alston came to the UK to investigate the phenomena of extreme poverty. And a lot of what he had to say was about our social care services. And I'm quoting from him now. He said, back then, social care services are at a breaking point. Policies pursued since 2010 amount to retrogressive measures in clear violation of the country's human rights obligations. And that indicates the extent to which the design of the social care system is a political design. And as the government is now discovering to our cost, the legal structure means that social care is a system that isn't regulated by command and control. It's regulated based on the existence of a market. There's a regulator, which in England is called the Care Quality Commission. And that regulator has got these legal responsibilities to go in and review and investigate providers on the basis of a set of regulatory standards. And those organisations' performance is set out in a public document that's made publicly available so that the public supposedly can make an informed choice about which care service they want to choose to use. And local authorities, they haven't got duties now to provide care services. They've got a duty to promote the efficient and effective functioning of the market, which means that they are legally obliged to ensure that people have got a choice in that market. And the way that Philip Alston reported this back to the United Nations Human Rights Council was to say, local authorities have abandoned responsibilities by relegating key services to the private sector. And he said people had been abandoned to the private market in relation to services that affect every dimension of their basic well-being without access to minimum standards and incompatible with human rights. So it's certainly true that's really difficult to establish mechanisms of accountability within the social care system right now. So when we're looking at these TV programs, when we're seeing older people being left to die with not much intervention other than wonderful care workers who are holding their hands without having adequate PPE, without having had training in how to deal with people dying from acute respiratory failures, with their massive fears that everybody else in the home is going to get infected. We need to think about violations of rights, and we need to think about the design of the system, because formally it's the care homes, the home care providers as employers who've got legal responsibilities for health and safety of their workforce and the people that are using their services. It's the care homes and the home care providers who are these registered providers who have got responsibilities for safeguarding people and meeting fundamental standards. But they exist in this marketplace of 30,000 different registered providers just in England alone. And they employ a workforce of about 2 million people. And there is no direct connection between the government and the care workforce. So no matter how many times the Secretary of State for Health and Social Care says that the NHS and care workers are kind of part of this big family, that doesn't make it true. The social care workforce is enormous and far bigger than the NHS workforce. And a key reason for privatisation has been the reduction of labour cost, has been to make it so that the government has had no connection legally with that workforce. Because if I take you back to the 1990s, that's when care workers were making really big gains in terms of their equal pay rights when they worked in local authorities. And that wasn't funded properly by central government. It wasn't prioritised by local government. And it became necessary, in inverted commas, to privatise this workforce because the private providers didn't have to pay the care workers in line or with any respect for equality to male workers who were employed in local authorities. And so in order to make and keep the care workforce cheap, they were privatised. And this happened at the same time as care was going out into the community, at the same time as more institutions were being closed down and our population is ageing. So the sector was getting bigger and bigger and bigger, and it's now almost exclusively provided by private sector organisations. So what happened? Well, okay, the equal pay's gone by the by. Then the care workforce, well, they lost their occupational sick pay and they lost their occupational pensions and they lost their guaranteed hours contracts. They lost being able to know that they were going to actually get paid when they did a week's work for all the hours that they worked. And all these 0 hours contracts were introduced. And then the hourly wages fell down to minimum wage level. And then because of the 0 hours contracts, it became really difficult to know whether they were actually getting the minimum wage, because not all the hours of work. And then finally, care workers have lost their rights to minimum wage for shifts when they've been working overnights. And this was a decision in 2018 by the Court of Appeal, which is currently being re-examined by the Supreme Court. But that decision treated care workers differently from any other type of worker in the UK workforce. So if you're a security guard and you're keeping an eye on the factory and you're allowed to go to sleep on the overnight when there's kind of nothing going on, you must be protected by minimum wage because your employer requires you to be there. But for care workers, the Court of Appeal found that care workers weren't actually doing work, again in inverted commas, for the purposes of national minimum wage protection when they were on these sleep-in shifts. So kind of that's the point that we've got to with this. And then the virus hit. So, you know, employers can't access PPE. The NHS can't get older people out of hospital quick enough. The government hasn't kept up with its PPE supplies, so it's not available. Care workers haven't got any wages when they need to self-isolate. The government seems to think it's sufficient to say that they can claim statutory sick pay, which is £96 a week, and the government hasn't made any other provision for this key workforce. You know, these people that we clap as our national heroes, they are supposed to live on £96 a week in order to keep other people safe. We've got 122,000 vacancies in the system. Average wages are somewhere between £8.10 and £8.30 an hour, and people are dying. They're dying unnecessarily, and they're dying as a consequence of the structures and the systems that we've got. So I think that we need to make some decisions about whether care really is private. Is it a private matter, or is it the business of all of us? And what do we all want? What do we want for ourselves? And I think that's a more useful question than constantly referring to the most vulnerable members of society. I understand where that phrase is coming from, but it kind of suggests it's not us. All the time, it's not us, it's not us, it's not us. But we are all vulnerable. We are all human. We are all hopefully going to get old. And we all could become disabled. We all get ill. And we need to think what we want from ourselves. What do we really want? And I suggest that we may want to design a system where organisations are accountable for the delivery of services, and where people in care homes and using home care services are not constructed as though they are supposed to be some kind of choosing customers that are going into these care homes that can kind of change their mind if they don't get the right kind of care that they like. And that we hold on to these pictures of these desperate tragedies that are happening at the moment, that are happening tonight in care homes, in care home services, in home care, and that we recognise that it's part of a very, very big picture. It took us a very long time to get into this mess, and it needs a fundamental rethink of the legal relationships and the politics behind it all if we're going to get some meaningful change.
Lydia, thank you so much for that. very forensic look really at the problem and some of the things that we need to be demanding. I was a care worker when I was at university, and I used to do sleep-ins, and I think I used to get £25 for a sleep-in, but you might start your shift at 2 o'clock, then take it up to 10, then your kind of sleep and night shift rate would begin, and then you would start again at say 8 in the morning or 7 in the morning. You could be there for 24 hours and you would be earning very much less than the minimum wage. Then this was years and years and years ago. The idea that you are not working is a joke. You know, people would wake up in the middle of the night, the women that I used to care for, with very, very distressing episodes, very much need support and care. And there were people, you know, there are people doing this day in, day out as their job, you know, and the idea that this very complex care, this very, very important work does not afford you enough to actually live on is a shocking indictment of the system that has been created in this society. And I, you know, have to kind of, I hope this doesn't sound kind of patronizing, it's not meant to be, but you've dedicated your life to this work and trying to see transformation in this sector. And I would really implore people to go and look at a lot of what Lydia has written about this sector. And to me, it seems like, you know, social care is almost the poor relation of the NHS, and you will know more than me, but that was a deliberate political decision to make sure that this system is privatised, that there isn't a state responsibility for this. And I found it a very interesting way you described it, that there are no kind of central mechanisms of control. And that is one of the reasons we're seeing such a failure of the government to get a grip of what's happening in social care. What an important point. Just a couple of announcements before we move on to Professor Alison Pollock, who I am very, very, very pleased is here with us tonight. Tomorrow, at 7 p.m, we have a May Day celebration on behalf of the People's Assembly. We really hope you can join us because, yes, there will be politics, of course. What else do you do on a Friday night? But there's going to be culture too, because we've got Loki, the excellent artist Loki. We've got Jerry Potter, the poet. We've got the wonderful actress Maxine Peake, and we've got former leader of the Labour Party Jeremy Corbyn to kind of take us through that celebration, of course with politics, but with music, poetry and performance too. So please join us tomorrow at 7 p.m. Also, and lastly, before I move on the 7th of May, this is really important. What does activism look like when we're all locked inside? We can't take to the streets, quite rightly, to protest against this government's mishandling of this crisis, but we can all meet together online. So the People's Assembly is trying what I think will be a first, which is an online takeover. So we are trying to take over as many accounts as possible for probably an hour and a half on the 7th of May to talk to as many people as possible. And we're going to try and have as many elements of the movement represented too, to firstly set out the problem as they see it very succinctly, because we're going to have to get through the movement quite quickly, but then also their demands in this crisis and their demands when we emerge from this crisis, about what kind of world we want to see. So we want to try and set a world record. I'm just being a bit dramatic now, but we want to try and have as many viewers as possible who are thinking about the problem, but most importantly, the solution and the demands in the crisis and when we emerge from it. So 7th of May, be there, be part of the world record on the online mass movement takeover. I first met Alison Pollock probably about 3 years ago now, when she was providing invaluable advice on how essentially the NHS had been privatised. Much of what she told me I hadn't known about. She published a book too called NHS PLC, an absolutely fascinating read. Please go and take a look at that. She's Professor of Public Health at Newcastle University, is a doctor who's a consultant in public health medicine, and was the director of the Institute of Health and Society. Alison, let's hear what you've got to say, your take on this crisis, how we got here, and what we should be demanding. Thanks, Alison.
Well, it's hard to follow on from Lydia because she's done such an amazing expose and exposition of what's happened. And I agree with Lydia. I would go further. We need a national health and social care service, and it should be integrated. As Lydia said, before I go into the COVID crisis, just a bit of background. We used to have 450,000 beds in the NHS. We now have fewer than 120,000. And now we have 450,000 odd beds in, guess what, the for-profit private sector. So over decades, what we've done is the NHS, which used to have responsibility for looking after older people and people with learning difficulties and mental health, rightly, the big institutions were closed with more care in the community, but unfortunately, a lot of these institutions, NHS, when they were closed, patients were then shunted after 1990 to become the responsibility of local authorities, who in turn, because of huge budgetary cuts, found the easiest solution to dealing with cuts was to privatise, sell off the homes, sometimes for a penny, some homes sold for a penny. And what we now have is 400,000 plus people in homes, many of whom would once upon have been eligible for free NHS care in NHS facilities. And of course, this is the government's solution, as Lydia says, is the market. So what we've seen is all the other alternatives like sheltered housing, warden-controlled housing, supported living, it's also been decimated and cut. And the other thing is that local authority budgets, which have been they've been reduced by nearly 50% over the last 10 years plus. That means that the care packages that people receive have been seriously reduced, that only those who are greatest need are getting them. So all the preventative work that goes on. And so it's really quite shocking that older people and their relatives are left to a marketplace. And let's not kid ourselves, in spite of what Care UK says, these are not philanthropic organisations. They're 84% for-profit private sector operators who have found all sorts of ways to skim the money and make it look like they're unprofitable, including sale and leaseback arrangements and paying huge rental charges and interest. And so that makes it look like they're broke, so they go bleating to the government for more money. But as Lydia has said, the real casualty of privatisation and local authorities' decision to outsource have been the residents and the care staff. Because you get something what's called quality shaving. You get the care staff, first of all, the regulations around having registered nurses were relaxed, the numbers and the ratios on shifts. Care staff increasingly were expected to do their own training. It's been absolutely abysmal. So you have some of the most vulnerable people in the workforce looking after the most vulnerable. And as Lydia has said, about 10% vacancy rate even before COVID started, but we know in Scotland it's a 25% vacancy rate. The thing that shocked me was in January, we knew from the Chinese data that this is a virus that spares the young and kills the old. It set panic and hysteria going amongst us all. But you must remember, this virus does not kill young people. Very exceptionally do children get it and then become very ill, nor younger people. It really doesn't start to kick in until people are in the 70s plus. And even then it'll go for subgroups with serious illnesses. So the group that was most vulnerable were those in receipt of social care at home and those in nursing homes. So the two things the government did was to delay putting in the public health measures, and they would have been monitoring the disease outbreaks and doing something called contact tracing and tracking, so you would try and find the reservoirs of infection. And that should have been especially happening in nursing homes. It was not a surprise to find that nearly 40–50% of nursing homes now, deaths in COVID in some weeks will be nursing home deaths. And they failed to shield the elderly. We have all been told to lock down, but the government failed to shield those most at risk. And as Lydia says, what it should have done is it should have actually requisitioned these homes. It should have put all the staff on national terms and conditions so that they had sick pay, not statutory sick pay, but they still earn their salary when they were off for the 14 days. Because somebody who's on statutory sick pay or 0-hour contract is going to go into work when they feel sick because they have to. And that means that they're carrying the virus into the homes and out of the homes. So what the government should have done was had a roster of all staff. It should have been able, and that roster should have been published for every nursing home, so we knew where the COVID cases were, where they were positive, where they were negative among staff, where the clusters were, where the staff were. But at the same time, they should have doubled and tripled the care staff going in. And they could have done that in several ways. I, as a 15 and 16-year-old, before I did medicine, that was the best experience and training I ever had, was working in a nursing home. Actually, it was an NHS facility for geriatrics, as it was called in those days. And so there are lots of ways in which the government could have done it. First of all the medical students and nursing students that graduated early, they were all graduated in February or March and told that they had to go be ready for the workforce. Instead of putting them into the NHS, where actually there was no need for them and is no need for them because the hospitals are half empty, many of them, and very quiet, they could have trained that workforce and redeployed them to work alongside care staff. And they could have done many of the tasks that the care staff then could have been freed up to spend more time with patients. So by doubling and tripling your ratio, you're doing a number of things. You're stopping the transmission because you would have had dedicated staff for patients, and you would have been isolating staff and patients in groups. You would also have been improving the quality of care. We know that the number of staff and the number of trained staff is directly proportional to quality. And all the data and research shows that for-profit institutions have lower quality care. And the reason why they have lower quality care is not because the staff don't care, but because the staff costs and budgets are cut so much that there are not enough staff to care, and staff are struggling. Moreover, care staff are not trained to look after very sick and dying people. And the second really frightening thing about this, and Lydia has said, the suspension of regulations for inspection, is that right, Lydia? You said CQC is suspended. This is terrifying. It's terrifying because relatives and visitors are the eyes and ears of the nursing home. They are the ones that report, they complain, they point things out, and they keep everybody on their toes. Once they've gone, you have what Goffman would call closed institutions. So you don't know what's going on, and especially you don't know how, when the staff levels are very low, the panic and the fear in the staff, and also the panic, the fear and the anxiety and the depression of the residents. I have two friends in nursing homes who've not seen their relatives for 6 weeks. They're locked in their rooms, they can't even see the relatives from the windows, which is extraordinary, and they get their meals delivered 3 times a day by harried, pressed care staff. It's not that the care staff don't care, they don't have enough time to care. And when people are sick, they need a lot of care. So isolation, closed institutions is dangerous. They need to have a mechanism for the ombudsman, for inspection, for complaints. And actually, I think this is inhumane, not allowing visitors to visit, let alone visitors to come when people are dying. And that's the other great fear, is the excess deaths. There is no doubt that many people in these nursing homes and social care are unnecessary deaths and premature deaths, partly because of COVID, but also because of other conditions, because many of the GPs have not been going into homes, but neither have all the other supports they have. So now that we've closed the community health services, elective care has stopped there. So OT, speech therapy, physio, all of these services should have been going into the homes, along with medical teams and nursing teams. And that would have made a huge difference to the anxiety of the staff and the residents, because to be left alone to die on your own without family is pretty inhumane. and for staff struggling, it's very, very terrifying. Anybody who's looked after a dying patient knows how terrifying it is. So the government absolutely failed because it's not interested in the old, it's not interested in the consequences of this. What it is doing, what Matt Hancock is doing, is it's building up for more privatization and commercialization and commodification. We can see it with the debacle of the testing centres, which are now being operated by for-profit providers through centralised hubs, and they're not reporting the tests to local level. These testing centres that you go to, many of them now are operated by companies like Deloitte, which is a management consultant, but there's a chain of them if you look at the government website. And the capacity which was there in the NHS laboratories and in the universities has not properly been used. Instead, they've raided these laboratories for their testing machines and their staff. But these are big commercial contracts. The same with the apps which the government will be announcing for contact tracing. So what the government has done is it's absolutely gutting out our local social care services and our local health services. It's decimated and destroyed them. And that brings me to the other point, which is what's happened to communicable disease control and public health. That has been fragmented, carved out of health services. Part of it was put into local authorities and part of it, the communicable disease, into Public Health England, which has had £500 million worth of cuts. And it's why it wasn't in any position to respond. The government has treated this, instead of hundreds and thousands of local outbreaks needing to be tackled and put out locally, as you would any local fires, it's treated it as a national epidemic, needing only one big lockdown. And above all, by not doing what's called the contact tracing, by hunting for the cases, hunting for the contacts, quarantining and isolating at the local level, it's actually failed once again our nursing home community, because if contact tracing had been there and the staffing had been there, the government would have got on top of these cases. It would have identified who was transmitting it, who was at risk, where the clusters of cases were, and it would have quarantined all the staff sooner and earlier that were affected or at risk, and it would have brought in new staff. The government has a lot to answer for in delay, in lack of preparation. But I think the key issue is less than even PPE, is actually the staff. The government has failed to allocate the resources to social care by requisitioning the homes and putting in the staff and doing the public health measures and allowing the community responses locally. And I suppose that will bring me to my last point, which is, and I've said it before, the government's mantra is stay at home, protect the NHS and save lives. I did not expect to be asked to protect the NHS. I was always told all my life that the NHS was there to protect us and to save our lives. So I think the government, this propaganda, has got it all wrong. It's time the government started to protect us by rebuilding our health services, rebuilding our community services, rebuilding social care in imaginative ways that respond to what people need at local level. And that means not just big residential care homes, not just 15-minute packages of care. It means actually putting in the kinds of facilities that people want, whether it be sheltered housing, warden-controlled homes, community living, all of these imaginative things. But that needs to be done by the state. And we have squandered billions on private sector contracts that went to Nightingale hospitals that are lying completely empty and have unstaffed in most parts of the country. That's hundreds of millions of pounds when the army could have been deployed to doing contact tracing, or even some of them to caring. We've squandered billions, hundreds of millions on high-tech solutions, and now on these testing centres, and now on these private partnerships on vaccines and drug trials. and we are not working collaboratively and cooperatively with other countries to arrive at the optimal solution for the public health. And at the moment, we have a government that is not putting the public health and local people first. I'll stop here because I know you want to take some questions, Laura.
Alison, thank you so much. And it just kind of, when you're not listening to the government briefings, it kind of, and you're listening to experts, it kind of shows you in a very calm way that there is so much that the government has got wrong, and we take no pleasure in saying that, but there is. And I want to go straight away to ask some questions. If the responses could be as quick as possible, because we have very little time left. The main question that has come in actually, and I'll just say, John Robertson asked, I would like to ask the panelists, how do we practically renationalise the healthcare system? Does the government simply kick out private business, pretending we had a different government that weren't ideologically opposed to, to public ownership? But what would we practically do? We have to campaign for so much. Nationalisation of our health and care sector is right up there. How do we do it? Lydia, over to you. 30 seconds.
So I'm going to let Alison deal with the how to bring it back into public ownership point. I want to say that we desperately need collective bargaining across the social care sector. It's a key difference between social care and the NHS. We need minimum standards right across all different care settings. And we need care workers to be involved in negotiating those standards. So decent pay, training, standards around PPE, all sorts of things about career progression. These need to be set by representatives, by trade unions and employers coming together and bargaining, negotiating and holding one another to account. So that if we do have competition between these providers, it is never, ever, ever about competition over appallingly low labour standards and pay levels. That there is a floor put underneath the system as it exists, and we implement sectoral collective bargaining. It is TUC policy to work towards this now, and we need to move forward. It is absolutely essential, and it could be done really quite quickly.
Thank you. Alison?
Well, you need legislation, you need political will, and that comes from the people voting for putting pressure on political parties, and those political parties, when they come to power, and even if they are in power, having the political will. And as you know, Laura, we worked very hard on the NHS Reinstatement Bill, the bill to reinstate the NHS in England, because though most people think we still have an NHS in England, much of it has been decimated and lost. It's been privatised and fragmented and very seriously reduced, largely as a factor of marketisation and the removal of the duty on the Secretary of State. So we do need legislation. We'll need it for the social care as well. And one of the things to say is the government is busy throwing billions of pounds at business at the moment, and the local authorities are being asked to give the money to the private sector. But this is an opportunity at the moment for the government. It should really have requisitioned these homes, because many of these for-profit companies are actually broke. They're not doing terribly well at the moment. They were doing in the past, and they've made hundreds of millions. So either the government takes a 55% stake, and that way it controls what shares and profits are going and how they're doing it, or it simply takes over these homes again and actually puts them back into public ownership. They were in public ownership. They belonged to local authorities, they belonged to the NHS, some of them were voluntary, but they were largely in local ownership. And that is the great tragedy of this privatisation. So that takes political will.
And mass kind of public pressure to force those politicians. And I think these conditions, surely out of any conditions in the last 100 years, shows that, you know, your research, your publications, the demands of the movement have been vindicated, because the vulnerabilities in the care sector, privatisation, no central mechanisms of control, have kind of intensified the vulnerabilities during this crisis. But just to let you know, somebody said, sorry.
I want to say one other thing about the COVID legislation.
Yeah.
One of the things that neither Lydia or I mentioned is the way it has reduced older people's rights to healthcare and social care. It's reduced it to a floor, a basic minimum compatible with life. That's not good enough. Food, water, you know. Actually, that is one of the most shocking things about the COVID legislation. So people should look at the Disability Law Project and what they've said, and also my website and Lydia's as well. Sorry, I just wanted to make this point.
Yeah, it's very important. And actually, we were talking at the People's Assembly about a whole special around disability rights and DNR, do not resuscitate, that have been sent out to some communities. I think that is certainly worth exploring. I just, you know, Paul had said that until he had heard Lydia speak, he thought that nobody cared about the care sector, or certainly didn't know about their stories. So thank you so much for that. And lots of people have asked about political priorities. There is so much going on right now in the welfare system, in the world of industry and work, care, NHS, our communities are under intense pressure. So I'm going to kind of combine everybody's questions to this one last question for you both to answer, if that's okay. What, if you had kind of control over one thing, what would be the one thing that you would campaign on, and that you would ask everybody to join in solidarity with? I know that's a bit hard when you're literally, quite literally experts in this, but we're going to have to get a bit of focus around our demands in relation to the NHS and the care sector. So what would be your kind of rallying cry to people? Can I start with you, Lydia? And you've got a minute and a half.
Funding and accountability in social care. If we carry on the way we're going, what is going to happen very quickly is that women will not be going to work, because they will be back at home with no facility for the state to provide care. And that is going to impact on poorer households and poorer women. It is going to devastate our economy as we understand it. It is disastrous for women's equality. What happens in social care is absolutely foundational in terms of people with disabilities and their ability to be able to live decent lives and respected as human beings. You know, no matter how old or what people's various different abilities or situations that they're in, we need to start valuing human life. And we need to fund this properly, and we need to stop this stuff around, oh, we need to stop making this political. It's got to be about political consensus. The politicians can't do anything because it needs to be political consensus. No, this is massively political. We need to talk about this. It needs to be put right. We need to invest in social care.
Thank you. And the last minute and a half, the last rally cry is over to you, Alison.
Well, I would also, first of all, I would call for the reinstatement of the NHS in England, but that doesn't go far enough because it has to deal with social care. We have to have a really radical plan for reform, and I set that out in an editorial in the British Medical Journal that you can download with 2 other colleagues. One of the things we must remember is that the state is paying for social care already. I think it's something like 15 or 16 billion pounds, Lydia can correct me. We are paying for it through our taxes, because basically most people spend down until they're too poor to pay. So they're reduced to poverty when they go into homes. And then we're paying for it. So therefore we need to have a say over where the money goes and how it's spent, which means that we can say we want to end privatisation, and we want to have public control, public accountability, and public ownership, because we already have, the Exchequer is paying billions out every year from our taxpayer funds. So if we fund it, we want it accountable, we want it publicly owned, and we want a really good plan which involves communities deciding how they're going to organise and arrange their social care for the future.
Thank you so much, honestly, to you both. I think, as with every single week, what we ask people to do is just get involved in any way that you possibly can. There are big demands that have come out of tonight's meeting, you know, not least to end the privatisation in the NHS and in social care, to bring it back into public ownership, not just because we want to satisfy political fantasies. Both Lydia and Alison have just outlined the consequences of the privatisation of the NHS, the mass underfunding of those systems. It results in people suffering, and that is what we want to end. It results in people dying prematurely. So these aren't just purely ideological fixations, although having ideology is nothing to be ashamed of. This is about human life and the sanctity of it and how well people can live their lives. Thank you so much for tuning in again tonight, and we hope to see you next week for our mass online takeover where we're going to break a world record. Thank you very much. Stay as safe and well as you possibly can. Thank you.
Thanks very much, Laura. Thank you, Lydia.
Thank you.